Today, the U.S. announced that it would be providing additional humanitarian aid through the World Food Program to Yemen, including areas controlled by Houthi rebels. The Houthis have been fighting a U.S. and Saudi-backed government in exile for years. But as the coronavirus crisis hits a nation already at war, even deeper desperation has set in, as it has in another nation mired in conflict, Libya, where Nick Schifrin begins this report.
On the front line in Libya, the war never stopped. So there are now two wars. The spraying of bullets between the internationally recognized government and fighters loyal to an insurgent commander, and the spraying of disinfectant and social distancing measures to combat coronavirus. For more than a year, UN-backed President Faisal al-Sarraj of the Government of National Accord and former military leader and U.S. citizen Khalifa Haftar have been fighting for control of Libya. The fighting has driven hundreds of thousands of people into camps. And now that the front line has moved to President Sarraj's power base in the capital Tripoli, civilians are caught in the middle. This bedroom was hit by a rocket that crashed through Abdul Monim al-Sharif's roof.
What happened today was shelling in our area. The shells were indiscriminate, and this is my mother's apartment.
As Libya's confirmed coronavirus cases hit 63, Haftar is also targeting medical facilities. Dr. Fawzia Abdullah stands outside a Tripoli hospital, where a rocket attack left cars full of shrapnel and a hole in the side of a building.
It is time to put armed conflict on lockdown and focus together on the true fight of our lives.
That call has gone unheeded, and if anything, the battle over Libya's future intensified. Last week, Haftar supporters declared him Libya's rightful leader, and he rejected a UN-backed political deal that's in place today.
Dear Free Libyans, we have monitored your response to our call to you by announcing the dropping of the suspected political agreement that destroyed the country.
President Sarraj has control of major port cities in the north, but little else, says Thomas Hill, a Libya expert at the U.S. Institute of Peace.
Even though they are nominally the head of the Libyan government and the Libyan state, their power does not extend much beyond Tripoli.
And the fighting is fueled by foreign forces on opposing sides.
You have Italy, more on the side of the Government of National Accord, the U.S. on the sidelines, and on the other side you see the French, the Emiratis, the Egyptians, sometimes the Saudis, the Russians, sometimes the Jordanians, all backing General Haftar and his Libya Arab Armed Forces.
In another intractable conflict to the east, Yemen is also ill-equipped for a pandemic. For 5 years, the civil war has raged between Iran-backed Houthi rebels and the Saudi-backed government of Mansour Hadi in exile. In late March, the Houthis launched ballistic missiles into Saudi Arabia, and the Saudis struck Houthi targets in the capital Sana'a. In April, Saudi Arabia announced a unilateral ceasefire, releasing this statement: "The chance is still there for concerted efforts to reach a comprehensive and permanent ceasefire." The Houthis rejected it.
The Saudi declaration is not a declaration of ceasefire. It is continuation of the war.
The U.S. had cut humanitarian funding in Houthi-controlled areas, fearing rebels diverting the aid. But today's announcement means the funding will resume. It's badly needed. At a hospital in Houthi-controlled Sana'a, beds don't have mattresses, and most of the 20 ventilators are in disrepair. Civilians all over the country who've fled their homes and now live in camps feel forsaken.
Neither the state nor the organizations are helping us. They're telling us to stay inside the camp. How are we to just sit inside when no one is helping us?
Yemen's humanitarian crisis is one of the world's most severe, 1.3 million cases of cholera since 2016. Widespread flooding that destroyed vital infrastructure. A coronavirus outbreak could be disastrous, says World Health Organization representative Altaf Musani.
Millions of Yemenis depend on humanitarian assistance every month. And so the virus, such as COVID-19 coming to Yemen, is catastrophic.
For Yemen and Libya, where resources and patience were already thin, this is the worst time for another war. For the PBS NewsHour, I'm Nick Schifrin.